There are a number of anxiety disorders around. The most common one is we call generalized anxiety, which is really describing people who tend to worry excessively and often have physical symptoms like muscle tension, fatigue, sweating. And sometimes they'll internalise, they'll worry away, and sometimes they'll externalise it with lots of irritability. That's the commonest manifestation of anxiety. The next one is where somebody has a panic attack, and these are very horrible experiences.
I knew a woman who told me that she used to wake up in the middle of the night just in a sweat, in terror, and she was having a panic attack.
As part of the life story, though, of somebody with panic attacks, they'll frequently say, well, I think certain situations bring it on, so like going to the supermarket or being in a bus. And frequently they start to avoid the situations where they think it comes on. And the risk is their whole world can narrow down. They won't go to the supermarket, they won't go on a bus, they won't go to a restaurant, they won't go to a picture theatre. They tend to stay home. If they get out of the home, they might need to have a companion. So a child, or wear dark glasses, use a whole series of strategies because they see the world as dangerous, as a place where panic can come on.
You get a lot of physical symptoms that come with anxiety. You get, the sort of lump in the throat, breathing difficulty, chest pain, churning gut, diarrhea, sort of dry mouth, and sweaty skin.
And there are other expressions of anxiety, for instance social phobia. We're all social phobic to some degree, where we feel that when we stand up in front of people they're going to think we're fools, or that we might blush. So social anxiety is very common. And the final important group of anxiety disorders is obsessive compulsive disorder, and this is where somebody has an obsession, like my house is incredibly dirty, the toilets are dirty, I must scrub them for 3 hours. Then you get examples become a little bit more unusual, such as I'm contaminated with germs, so I will have to wash my left arm in the shower 27 times and my right 36. So spend 3 hours in the shower, get out, not be sure that you did it 27 and 36 times respectively, and go back in and do it again. This can be very severe and very troubling. And with these people, the usual strategy is to settle the anxiety, and sometimes they end up in emergency departments, sometimes they can be talked down, and then they're given a whole series of anxiety relieving strategies.
If a person's been anxious for long enough, they get depressed.
All the anxiety disorders significantly increase your chance of developing depression, and by major factor, each of them.